in your falx cerebri, which is basically the meningeal folds of the dura mater within the longitudinal fissure, stabilizing both hemispheres. Right here. I'm sorry, I'm being a little slow because I want you to make sure you see these structures. Right here we can see what's called the cribriform plate of the ethmoid bone. This is where, right here on either side, you would have your olfactory bulb, the olfactory bulb of the olfactory nerve, cranial nerve number 1, setting in. And we can see the optic canal. This is where your cranial nerve number 2 exits, or actually enters, because this is sensory vision. Optic groove right here. This is where the optic chiasm rests, and this is the sphenoid bone. Now we can see, let me get my other hand. So I'm trying to get my, so I can see this a little better. I'm trying to make sure this stays into focus. I'll get a little angled shot so you can actually see this three-dimensionally. There's a little recess right here. This is called the sella turcica of the sphenoid bone, which is known as the Turkish saddle. And you can see there's the dorsum sella. This is the back of the saddle. And right here you can see the sphenoid bone where my thumb is, and occipital bone uniting. This is where you're going to find your pons of the brain residing right here. We can see foramen rotundum, foramen lacerum. Now, foramen lacerum is comprised of sphenoid, temporal, and occipital bones. Laceration to tear. Foramen oval, sometimes referred to as oval, and this really small one, or I can really see it on this side better, the very tiny one, foramen spinosum, because it is on the spine of the sphenoid bone. And this is right where the sphenoid spine, see, is articulating with the temporal bone. I'm going to have to try to get a little closer and at a different angle so you can see. For orientation, if we look deep inside, there's the foramen lacerum right there. I have to get it at an angle, and we can actually see at a posterior angle coming in. That little opening right there, that is the carotid canal. The carotid canal is where your internal carotid artery comes in through the temporal bone and kind of elbows up in that little space where that foramen lacerum is, and goes right into the circle of Willis to feed one of our main brain feeders. And we can just make it out right about here. Sorry about the angle. It's very difficult because this foramen does not go straight through to be able to see it because it transverses at kind of a posterior to anterior orientation on its travel, so we cannot just see it all the way through, but it is right here. So let's look at petrosal portion of the temporal bone. Inside the petrosal portion is where we have our ossicles. This is within the middle ear. From external to internal, we have our malleus, incus, and stapes. The hammer, the anvil, the stirrup. As we go posterior, we can see our internal auditory meatus. I believe this is where your cranial nerve number 7 and 8 come out through this foramen. We can see very clearly the jugular foramen. Now the jugular foramen is part of the temporal and occipital bone. We can just make out this, it's kind of hard to see, right there, hypoglossal foramen, and of course foramen magnum. Anterior, to posterior. I'm now going to show you where the cranial nerves exit the skull. I've talked about a couple of them. Here, cranial nerve number 1, olfactory nerve, comes up through. When I say exiting, it may be going out or coming in, but it is just how there's a communication from cranial nerves from the exterior to the brain. Cribriform plate. Cranial nerve number 1, olfactory nerve. This is where the bulbs are. Cranial nerve number 2. Optic canal of the sphenoid bone. There's a good angle right here. Optic canal. You can see a nice opening right there. This is where your optic nerve goes through. Cranial nerve number 3, oculomotor nerve. There's a good angle. Supraorbital fissure. You can see this. This would be between the, here's another angle. Between the lesser and greater wings of the sphenoid bone. This is where oculomotor nerve, that's cranial nerve number 3, abducens nerve, cranial nerve number 4, And the